And good evening, I'm Carmen Chow. We begin with the fight against coronavirus in Connecticut. The State Department of Public Health says the number of COVID-19 cases have gone up over the last 2 weeks. Several towns now placed back into red alert status. I spoke to the acting commissioner, who is reminding everyone to continue their safety protocols. This map shows 90% of towns and cities in Connecticut back in red alert. That means there are up to 15 new cases per 100,000 residents per day. It is believed 40% of these new cases are of the new variant, which is known to be more transmissible, especially within those who have not been vaccinated. Case rates for people 70 and older have gone down, this time seeing a spike in ages 20 to 29 years old. Department of Public Health Acting Commissioner Dr. Deidre Gifford believes the nice weather and vaccines are contributing factors to the increase.
We know that with the weather getting warmer and with more of us being vaccinated, that and all of us being fatigued from a year of the pandemic, that we're hearing some concern from clinicians that they see people letting their guard down.
The county with the highest case rate is New Haven County. The towns with the highest case rates are in the Waterbury-Naugatuck Valley area. While Governor Lamont has loosened restrictions in many public places, Dr. Gifford means it does not mean loosened habits.
The governor has been saying that, changing some of these sector rules doesn't mean that it's time to take off the mask and let our guard down completely.
She is urging everyone to continue to wear their mask and social distance. If you must travel, it is recommended you get tested when you come back and quarantine for 7 days. With 30% of the population who have gotten their first dose of the vaccine, she is telling everyone to hang on a little more until the vaccines open up to the remaining age groups this coming Thursday.